Good evening. You're watching a WION Special edition at 7 with me, Sana Khan. Medicines are a part and parcel of our daily lives. An antibiotic, which costs a few hundred rupees, comes at a much cheaper rate, but probably lack of awareness and trust on the doctor sometimes makes the patient overlook the price. Now, to make healthcare affordable in the country, the Indian Prime Minister-led central government is looking to make it mandatory for doctors to prescribe generic drugs. What will be the impact of this move? Why wasn't this done earlier? And will there be a possible backlash from the pharma companies who thrive on profits from the sales of these medicines? That's what we are talking about on the show this evening. And joining me is a very eminent panel of guests. Dr. M. He is the consultant physician to the President of India. With me here in the studio is Ms. Pushpa Girimaji. She's a consumer rights columnist and a consumer safety advocate. Also with me is Dr. Sudarshan Bilal. He's the chairman of the Manipal Health Enterprises. Thanks all of you very much for joining me. Now, I will come back to talk to my guests about this move. But first, here's the news. The government will make legal arrangements, it says, to ensure doctors prescribe generic medicines. The Indian Prime Minister said this on Monday, a move that could hurt big drug companies but benefit millions of poor people. It wasn't clear if the new proposal would seek to put an end to the use of costlier medicines from big pharma companies. Prescribing a generic medicine means doctors write the composition of the medicine, that's the name of the salt, and not the brand name. Now, the Prime Minister made these comments during an inauguration of a hospital in Surat. In fact, making medicines cheaper is a politically sensitive issue in a country like India as well, where many patented drugs are too costly for most people and where patented drugs account for under 10% of the total drug sales. Here's what the Prime Minister said.
करीब 700 दवाइयां उसके दाम तय कर लिए ताकि गंभीर से गंभीर बीमारी में गरीब से गरीब व्यक्ति को सस्ती दवाई मिले। ये काम किया। 2 महीने पहले हमने निर्णय कर दिया जो 40,000 रुपए में स्टैंड मिलता है वो उनको 6-7 हजार रुपए में बेचना पड़ेगा, देना पड़ेगा। जो 1.5 लाख में देते हैं वो 20-22 हजार रुपए में देना पड़ेगा ताकि गरीब से गरीब व्यक्ति को अफोर्डेबल, गरीब के लिए, मध्यम वर्ग के लिए आरोग्य सेवाएं सुचारू रूप से उपलब्ध हो। उस दिशा में सरकार एक के बाद एक कदम उठा रही है। अभी जो विजय भाई बता रहे थे, हम अस्पताल में सस्ती दवाई के लिए प्रधानमंत्री भारतीय जनऔषधि परियोजना ये प्रारंभ कर रहे हैं।
Now, the cost at which you buy your medicines from your local chemist is an inflated one, and the same medicine is available at a government-run Jan Aushadhi shop, for instance, at a much lesser price. Let's take a look at a comparative list of pricing of various medicines, some of the more common ones. For instance, a ciprofloxacin, a 250 mg tablet, costs about 12.89 rupees at a Jan Aushadhi center, while it costs you 54.79 rupees at the local chemist. A second instance is of a 500 milligram version of the same tablet, which can cost you 125 rupees at your chemist, whereas it could cost originally at a cheaper price of 24.99 rupees. That is 5 times the actual cost. A diclofenac tablet strip is available for 4.2 rupees at the Jan Aushadhi store, and at the medical store, the same costs a whopping 60 rupees. That's the kind of difference that one is talking about. A very common medicine like an anti-allergic cetrizine tablet should cost you 2.75 rupees, but when you go and buy it at the shop, it costs you 9.40 rupees. A paracetamol actual cost 3.03. Your cost is 9.40. That's the kind of the price difference we are talking about. Let's, in fact, get in our guest to talk a bit more about what this decision of the government means and will it actually work. Let me get in Ms. Pushpa Girimaji first. How do you see this move, and what would you say to the timing? Why wasn't this done earlier? This is a fact that, medicines which are much cheaper, these pharma companies, the private companies, sell it at a much higher cost. What made the Prime Minister think about it now?
Well, I guess they're taking many steps to kind of help consumers or citizens. So probably this is one of them. Maybe, sorry, somebody brought it to his notice and he may have mentioned it. That's also quite possible. But the fact of the matter is, in fact, I have been writing about it for so many years, campaigning about it. And successive governments have spoken about doing something, but they have never done it. So I really hope that this time something will happen and the government will do whatever is necessary to ensure that doctors prescribe generic medicines.
All right. So you welcome the move?
I really welcome it because, you know, there is, you know, I must say that consumers have a right to choice and they have a right to quality medicines at reasonable prices. And when a doctor writes only the brand, the name of a particular brand, and does not write the name of the generic name, then that means he or she is taking away the choice from consumers.
All right.
So if you write the generic name, then you have a choice. You know, there's a wide variety of brands. Plus, there is a vast difference in price, not just between the generic and the branded drugs, but also between the branded drugs. Like, for example, I know of a drug, a friend was prescribed by a dentist an antibiotic for 6 tablets, which cost something like 241. And the chemist said, are you sure you want the same thing or would you like something else? It was available for 72. And I checked. It was the same
salt.
Yeah, same salt.
Right.
And both the pharmaceutical companies were well-known, reputed companies.
Okay.
So we must have the choice.
Okay, let me get in Dr. Valli at this point. Dr. Valli, thanks so much for joining us. Now, this was something which was suggested by the Medical Council of India earlier as well, that one should prescribe a salt and not a brand. But there have to be pros and cons to this move. Now, the government talking about bringing a law, making it mandatory for doctors to prescribe the salt name. How do you see this move? Is this right? What are the pros and cons according to you?
Well, Sana, first of all, I would like to tell the audience that Prime Minister really spoke his heart. And what I keep telling to the people that, and our teachers used to teach us was, before moving your tip of pen, you should see the pocket of the patient. You should not write such a prescription that the patient cannot afford. So this was our standard teaching, affordability that is called today. And our teachers used to prescribe very cheap medicine to the poor, and maybe for some very rich patients they would go for costlier medicines, which they know now. What has happened over the 5 decades, the MIMS, that the book of index of the book, which used to be 40-50 pages, now it is 750 pages. There's so many companies making each medicine. That is the problem of India. In America, only one company is given license to make one particular drug with a brand name. Like you, I can take the name which is not in India, Lipitor. Lipitor was made and they earn trillions and trillions of rupees, Pfizer, like that. But in our India, already there exists a 3 rupees tablet of the same salt and there appears 60 rupees tablet of the same salt, like that.
Right.
This is happening. Prime Minister is right in saying we should prescribe. I will tell you one more interesting thing. When we are taught in pharmacology, we are always taught the generic names. In examination also we have to write generic names. Over a period of practice we forgot, sometimes we forget those generic names to the extent that we only remember the product names by company's choice, which is taught, really taught by the doctors in their OPDs. The representatives tell that my product of this same salt is superior than X company you are prescribing, so prescribe my brand. So this is what is carrying away the doctors, and which is a wrongful thing.
Absolutely. It seems it's become more about marketing, it's more competitive rather than putting the patient's interests first. Dr. Valli, do stay with me. I'll come back to you in just a bit. Dr. Sudarshan Bilal is also live with us. Dr. Bilal, your first reaction to the Prime Minister's comments, how do you see this move?
The right move. In fact, even before this law was going to come into force, we have encouraged our doctors to write generic names. And as you are aware, there are 2 kinds of generics. One is the generic and other one is the branded generic by the companies. Once the patent is over, they come up with the generics. And I think it's a good move because so far in our country, if the doctor writes a specific name for a drug, then the pharmacist is bound to give that drug. And if that drug is not available, they have to check with the doctor and ask them whether any other brand name can be given. Whereas in the US, for a long time, when you write a prescription, you can always write at the bottom substitution permitted, which means the pharmacist had the right to substitute it for a generic brand, which would be far less expensive. The bottom line is, one is this is good as long as the quality of the drug is maintained, and this is something that the institutions and also the drug controller has to look into, because we should not do any harm to the patient.
Right.
So any drug, generic, branded generic or a branded drug, I think should meet the quality standards of the country, and only then I think substituting for a generic brand would be a good move, and I assume the government has looked into all this. But in general, anything that reduces the cost of medical care is a boon for the patients.
So all of my guests on the panel are quite unanimously agree that this indeed sounds like a very good move, protecting the consumer interests, protecting the interests of the patients in the country by providing them with cheaper medicines. In fact, we went out and spoke to a couple of people in Delhi and Mumbai, what they thought about this. Let's try and listen in.
I know that medicine available for 200 is also available for 2000. So I think doctors should prescribe this exact name which has the salt and which is also cheap.
Costly है जी ये ब्रांड की मेडिसिन, और डॉक्टर जो मेडिसिन लिख देता है जिस शॉप पे उन्होंने बता दिया वहीं मिलेगी, कहीं और फिर मिलती नहीं, वापस वहीं जाके लेके आना पड़ता है चाहे कितनी दूर हो. स्पेशल डॉक्टर की स्पेशल मेडिसिन है.
I personally prefer is to sell only the ethical products, because I personally feel that there is no difference, but the reaction and the result of the medicine is slightly better than the generic medicines. As far as the doctors say, I don't believe it.
Honestly, we're not the experts. We need to have that trust on doctors that whatever they suggest is the best for us. And having personal experience in with the doctors advising us to select certain brands which were not the most cost effective.
With branded generic drugs which often have the same ingredients as branded big pharma ones, I think this definitely helps bring more medication into hands and increases affordability.
A moment like this is helping a common man to get the right prescription which is available cheaper in the market and will cure the disease which the common man wants to get cured for.
I'm not from Bangalore, and I don't have a personal doctor here, so I'm from somewhere else. So if there is a generic composition prescribed by the doctors, it will be helpful for me and many people like me.
Yes, it is a good initiative because basically when there is a brand, there is a extra cost added to that brand. But when now you're not recognizing as a brand, but you're going as a medicine, so it's easy for even a common man to buy and afford those medicines.
It is going to create for those people who are below economic levels, social economic level, where it is going to be a cheaper medicine. Most importantly, the composition is going to be same.
So we understand that a patient places an immense amount of trust when he or she goes to a doctor, completely trust the doctor to prescribe them with the absolute right sort of medication. But Ms. Girimaji, there is a problem here. When one goes to the chemist sometimes takes it upon himself to, suggest another name, perhaps it's the same salt. So will this move give more power to the pharmacist, take that power away from the doctor to say what's right for the patient and take it upon himself?
If a chemist is properly qualified, then he can suggest. Suppose, like I said, if a doctor prescribes a medicine which is more expensive, then the chemist can certainly suggest something cheaper. So similarly, when you go to him with a prescription of a generic drug, then he can, in fact, today you can see on his screen all the list of medicines which are available, the pharmaceutical companies, the price, everything. So you can always ask him to show you the entire screen and then take your pick. Also, today there are websites which also tell you, give you the whole list of drugs which are available once you mention the generic name. So in fact, I would suggest that now that the government is planning to come out with this, they should also come up with a mobile app through which one can get these kind of details.
Right.
So that would also help consumers make
consumer
an informed
awareness
choice.
Is also
absolutely, because particularly illiterate persons. It's in fact many doctors don't even tell them what the medicine is for. In fact, this prescribing generic drug has another major advantage, and that is preventing prescription errors. There have been any number of cases where the patient has been given by the chemist a wrong medication.
Right.
So at least if you know the salt, if you know what the generic drug is, then that kind of a mistake cannot happen.
Okay.
So in fact, in the US, the Drug Administration says that they have as many as 1.3 million injuries caused by such kind of wrong medication.
So that is something you're saying which can be provided.
And like again, we don't have any kind of a statistical data in the US. They say in the last 10 years, by using more and more of generic drugs, the health service saved as many as $7 or $8 trillion in 10 years.
That's a
so
huge
I think
number.
it's a huge, huge saving.
Dr. Wali, now you treat patients who are poorest of the poor from the society as well as the elite in the country. Now, there is also would you say that writing a medicine or a drug depends from person to person? There might be some who say that, oh, if the medicine is so cheap, it might not even perhaps work, or this company is better. I'd rather buy medicine from A company as compared to B because I've heard the name and I trust the medicine.
Yes, this very commonly happens, and the reason why for several years we are trying to push in generic medicines into the use is this is one factor why we are not able. There are already shops which are selling generic medicines. They are not successful to the extent Modi ji wants, and I think with this present initiative it would get more boost. I fully agree that pharma industry has to come in. You see, pharma industry is making huge profits out of medicines and the branded medicines. They should be lenient and kind. They should understand Modi ji's sense, what he talked, the heart with which he spoke, that we should be kind to the patient, we should not make undue profit from the patient, we should give cheaper availability of the stuff. He gave the example of his stents. They also came up with the cheaper devices. They are coming. Nadda ji is working on that. Our health minister has worked hard for his stents, and that is how you did a program on that as well one evening, I remember. So it is the pharma industry. In America, pharma industry is controlling doctors. In India, it should not. Number one, in America, pharma industry is giving contribution to various educational events. Here, most of them are not. So why should they make extra profit? It is the poor patient who is paying. Doctor is innocent most of the time. He doesn't know how much pharma company is making money out of this tablet which I am prescribing. He prescribes with sheer confidence and thinking that is a quality medicine of my quality work with quality prescription. But he doesn't know what's running behind the show. So it is not the doctor, it is the pharma company who are responsible for this happening in the market. So they should openly come out and say, look here Modi ji, we are with you, we will reduce the cost of our brands, at the same time you bring the generic together and we will keep the pricing.
In fact, Dr. Wali, we get your point. We get your point. You're speaking quite passionately about this. We tried to get in touch with a lot of pharmaceutical companies, but sadly none of them were ready to come out and speak about this. A clear indication that the kind of profits they're making, it's going to hurt them.
They will be ready
this move.
when their brands will stop selling. They will be ready when their brands will stop selling. Modi ji means something, he will do it like currency notes. He will do it, I'm seeing and foreseeing it.
In fact, let me
telling you today.
Hold on to that thought. Dr. Sudarshan Bilal. Now, Bilal, we talked about this short while ago with Ms. Girimaji as well. Do you feel that by doing so, the control that the pharmaceutical companies had, or the kind of marketing techniques they use with doctors, that's now going to shift and move away to the pharmacists, perhaps?
Well, I think there would be a change in their tactics, obviously. They want to do business and they want to make sure their products sell. However, I think ultimately the patients will decide, and I think the patients should be educated enough, and it's our business to educate them, that they should choose a drug which one is of high quality and also probably has a pricing that is less than the branded in case this law has to be successful.
Also, I'm going to ask you, Dr. Bilal, do you feel that this move will deny money for future research on drugs?
There may be some negative effects, but by and large, as long as you have a patent, which is for a new drug, then there won't be a generic in that particular molecule. So they would have had enough time to recover the costs of R&D before the patent expires. And obviously, once the patent expires, then the company itself may come up with a branded generic, or other companies might come up with a generic form. So in my opinion, as long as the patent rights are maintained, they would still have time to recover the R&D costs. So it may not affect a new drug molecule in a big way.
Now, we cannot complete this discussion by talking about what the government is doing versus what it can really achieve, the practicality. It looks, sure looks good on paper, but does the government have these kind of generic drugs which are extremely cheap, demand of which is extremely high, catering to such a large population? Does it have that kind of a supply chain as well? Ms. Girivaji, what do you have to say? These Jan Aushadhi Yojana, sometimes, you know, it's reported that out of 600 generic drugs that should be available at any given point in time, there are less than half of them available over the counter. Now, if you're talking about promoting generic drugs, promoting these cheaper drugs, shouldn't then the demand and supply be equal to achieve that?
Absolutely, but I'm sure the government is going to make those efforts. One is ensure that the quality of generic drugs are as good as the quality of branded drugs, and make available generic drugs in a large, you know, quantities, in large quantities, so that they are available without any problem. And having said that, I would also like to say one more thing. Today, consumers are paying huge amounts. You know, every time, you know, we all know about the nexus between pharmaceutical companies and the doctors, and the pharmaceutical companies spend a lot of money on doctors to promote their medicines. So I think to a large extent, if that comes down with, you know, promotion of generic drugs, which also means that the consumers who are now paying for those in the form of the price, in the form the price that they pay for medicines, that would also bring down the price, and I think that would also make a huge difference to the consumers.
All right, Dr. Wali, what do you have to say about the government's endeavor to make sure that the demand supply is equal, and also, you know, the quality of these drugs is maintained? They're not, you know, substandard or of low quality. That's also going to be, I think, one of the challenges that the government will have to look at now that it's announced this, you know, hinted at a law like this.
Yes, when the law will be made, it should be, again I will repeat my point. First of all, I would not agree. These days, Medical Council of India has put a strict regulation that pharma companies do not give gifts and they do not spend much on the doctors. It is not being done now. Yes, 10 years back, 6 years back, it was done. First thing. Second thing, the pharma industry should provide the generic medicine, so-called, we should not call it a cheaper medicine, but we should gradually switch over. It would be switch over to the generic names. It's actually, medicine is not generic. This is a misnomer. The content is generic. Well, you were talking about ciprofloxacin, that is generic, not that tablet is generic. There is a huge difference in perception, because the moment we say medicine is generic, patient gets an idea it's a cheaper and inferior medicine, and that is what is happening in the mind and psyche of the patient so far. That is why this move was not successful. Now, if we get the generic medicines made, as we are exporting to various countries, the pharma industry should keep their identity, making it more authentic. Like a generic paracetamol made by Glaxo, there should be stamp of Glaxo. There's no harm in it. If the Glaxo is making generic paracetamol for 2 rupees and marketing its own branded paracetamol for 6 rupees, it's left to the company. So patient is wise enough to select from the counter, a doctor is wise enough to prescribe from the counter 2 rupees paracetamol made by Glaxo. Here lies the point. So it is basically cooperation required from the pharma industry, which is a big chunk. Last time Mr. Nadda banned some combinations. They went to the High Court and got them allowed. This was wrong. I mean, they did not sit with the government. At this time, they should sit with the government and ask the government what they want for their patients. India still provides cheapest medicine around the countries. Even Bangladesh and Pakistan, the same tablets are 3 to 4 times price.
Absolutely. I think that's key, you know, a frank discussion, Dr. Wali, as you pointed out, between the pharma companies, right? A frank discussion, because it's the interest.
Poor men should not suffer.
Interest of the patients, the poor man in India, which is, you know, which is at risk of giving with wrong medication. Dr. Bilal, my last question to you. With most patients being ignorant and blindly trusting their doctors, such laws, if and when they come about, can they be misused by pharmacists and other middlemen who are engaged in supplying these drugs?
Well, there's always a scope for misuse of anything that is good. However, I think we should look at the overall balance of things, and in my opinion, I think use of generic drugs is definitely a positive point, and this is something that's happened in the US and the Western world for a long time. And I think our patients, even though some of them may not be educated, they are slowly learning the sort of rules of the game. And I think if someone says the constitution or the composition of the drug is what you write when you write a prescription, they would probably be smart enough to look and make sure that the composition of the drug is the same as what the doctor has written in the brand that has been given to them.
So we all agree that this move suggested by the Prime Minister is definitely in the best interests of the people of the country as far as providing them with cheaper healthcare, affordable healthcare is concerned. But what are the practicalities? How will it be implemented is another question. It's sad that we couldn't have a representative of the pharma companies to put out their point of view. But at this point, I'd like to thank all of my guests, Ms. Pushpagiri Maji, Dr. M. Wali and Dr. Sudarshan Bilal for joining me on this show. That's a wrap. Thanks so much for tuning in. I'm Sana Khan. News and updates continue right here on WION.